Welcome to part one of two videos on using motivational interviewing in vaccine hesitancy discussions. This video lays a foundation to understand motivational interviewing concepts before we have our conversations. So what is motivational interviewing? Motivational interviewing is a collaborative conversation style that seeks to elicit and strengthen a person's motivation and commitment to change. It is an evidence-based, practical communication approach developed by clinical psychologists William Miller and Stephen Rolnick. As someone that wants to use the motivational interviewing approach, it's important for you to first assess and be self-aware of your own communication style before attempting the motivational interviewing approach. This slide shows the different places we can fall in our communication styles. The director style is someone that takes the lead, telling people what they need to do because they feel like they have the information the patient needs to know to manage the situation and change. The follower style is someone who's a listener and does a lot more listening than they do the talking. They don't jump in to have a conversation, and there isn't any structure or input they add to the conversation. They listen and follow where a patient wants to go. And then there's the guide. The guide is someone that helps the patient through thoughtful, evocative, open questions and reflective listening to help them find that motivation for change. The guide falls between a director and follower, and that's where we want to be in motivational interviewing. If you find yourself to have the director communication style, then you can remind yourself that you are there to be a guide because we want to find that place of motivation in our patients to get the behavior change to occur. In healthcare, we naturally fall in a director communication style because the helper inside of us wants to explain things. But the outcome of that style doesn't necessarily get the patient where we need them to be, which can cause a roadblock and cause more harm than good. Roadblocks are distractions that get in the way of allowing the patient to explore their own motivations and ambivalence. Milner and Rolnick talk about these roadblocks as being self-centered versus client-centered, with the underlying message to the patient being, listen to me, I know best. There are many types of roadblocks, and there are obvious roadblocks to a conversation, but we can also fall into the lecturing side, giving advice that's unsolicited and providing solutions and the plan without including the patient. Lecturing is a roadblock because when we do this, you're not listening to the patient. And in the heart of motivational interviewing is really listening well to understand the person, their concerns and perspective. There's another roadblock that may not seem like a roadblock, and that's praising, because it places you up on a hierarchy, which patients may not respond well to, because it's like being in a parent-child relationship. It's saying, I'm happy with you because you did something I think is good. By using some of these roadblock approaches in our conversations, we may think we're doing things for their own good or even for the greater good, but we have to remember that the patient is an individual and we're not there to make choices for them. Sometimes giving advice and providing solutions may hinder the conversation and give the opposite effect of what we're looking for. Generally, we want to say something like, tell me about some concerns you have about the vaccine, because a statement like this opens the lines of communication because we're eliciting a conversation, letting them know we're interested in listening to them and understanding them and their concerns. As healthcare professionals, we often feel a strong urge to tell patients what to do because we've worked hard to gain our knowledge and therefore have strong feelings about what behaviors patients should change. But that overwhelming need to help and persuade falls into the writing reflex. Even though we know how risky some behaviors are and the dire consequences that can result, we need to remember it's normal to feel ambivalent. When we have been ambivalent in our own lives and someone has told us what to do, it was only natural for us to defend our stance. And we need to remember that that's what our patients are doing now. When we push too hard, we're setting it up so that the person is less likely to do what we want, even though it comes from a place of caring on our part. And it creates opportunities for people to argue with us instead of having an open conversation of sharing information. We need to remember that people change when they are ready, which may or may not be when or how we think they should be ready. So it's important to accept and roll with their resistance, with the hopes of eventually getting them to a place of comfort, trust, and acceptance to change. So when you have the urge to fix the problem by telling someone what to do, it is most likely your writing reflex. So suppress it as much as you can and don't project it out to your patient in the form of directions. Telling patients what to do doesn't work most of the time. It's tempting, but it can create the opposite effect of what we're looking for. When we have the urge for the writing reflex, we need to realize it within ourselves. Then pause and instead use reflections on what the patient said. So we can focus on what we've heard and engage the patient in conversation by listening and responding so that we can learn about what motivates them. And because we want to build trust with our patients and make them feel respected. We need to understand that true motivation for change is unique to each person. There's no one size fits all solution. So your communication style matters. And within the spirit of motivational interviewing, which is the foundation of every motivational interviewing conversation that takes place, are principles that emphasize a collaborative relationship in which the autonomy of the patient is respected and the patient's intrinsic resources for change are elicited by the clinician. It would be easy to think that motivational interviewing is a series of techniques, but in fact, we pay a lot of attention in motivational interviewing to not just the things that you're doing with your patients, but the underlying reasons for how and why you do those things, which we call the spirit of motivational interviewing. And the spirit of motivational interviewing is encompassed by four things: collaboration with your patients, acceptance of your patient, evocation from your patient, and compassion for your patient. Without the underlying spirit of motivational interviewing, you risk little to no change in your patient's behavior. The fundamental approach to motivational interviewing has four components that can be summarized in the acronym PACE. This is the spirit or mindset that clinicians should have when conducting motivational interviewing. PACE stands for partnership, acceptance, compassion, and evocation. Partnership means working in collaboration with your patient, where you are supportive rather than persuasive, and there's no power dynamic. It means working alongside your patient rather than being opposed to them. A confronting approach is the opposite of the spirit of motivational interviewing. In a partnership, we respect autonomy. And according to Miller and Rolnick, by working collaboratively, we create a positive atmosphere conducive to change and accept differences. We avoid persuasion and instead explore the concerns and ideas and view the patient as a partner so they are comfortable to discuss change. The patient should see the clinician as a guide who offers information about paths the patient may choose, not someone who decides the destination. Acceptance helps foster an attitude that we are on the patient's side and that their past choices in life do not negatively affect our perception of them. The patient should be accepted for who he or she is and not met with disapproval over any personal decisions that he or she made. It's acknowledging that each person has their own ability to make choices for themselves and respecting their autonomy in whatever choice they make, even though it may be different than the choice we would make for ourselves or for them. A statement of acceptance may be something like, at the end of the day, you get to decide. I don't want to put more pressure on you. I'm here to support you. Compassion is having empathy and trying to understand the patient's point of view and what the change means to them, and conveying we care without pushing our thoughts and beliefs onto them. Statements like, I can see how this is a really difficult decision for you, or it feels like people don't always understand your struggles. Demonstrate compassion, particularly if they are delivered in a genuine way, because it can make someone stop and reconsider their current stance and be open to what was discussed or shared. In evocation, we make every attempt to have discussions that can be evocative for the patient to bring out their motivation for change. Discussing a patient's feelings, thoughts, and memories can help change the patient's attitude towards behaviors they otherwise wouldn't think about changing. Asking questions such as, how do you see this pandemic ending? Tell me about some health issues that are important to you. Or knowing that they've received a vaccine in the past, you can say, what motivated you to get that vaccine? Are all examples of evocative questions. Being aware of our communication style, avoiding the writing reflex, and demonstrating the spirit of motivational interviewing will be the biggest drivers in the patient's willingness to change when done in a genuine way. Once you are comfortable with the concepts and understand the foundation of motivational interviewing, please view part 2, which will discuss how to use the skills in motivational interviewing in practice with a patient, called Utilizing Motivational Interviewing in Vaccine Hesitancy Discussions. There's a lot more that can be learned about motivational interviewing, so if you're interested in gaining more knowledge, consider referencing the following resources. These links will be provided in the description of this video for easy access. And the following resources are recommended books by Miller and Rolnick. Thank you for watching this session. We hope you've gained some foundational knowledge of motivational interviewing concepts to begin your journey in motivational interviewing conversations. Please contact us if you have any questions or would like to join our partnership. We look forward to hearing from you, and we hope you have a wonderful rest of your day.